Hello everyone, welcome back to Community Medicine Insight. In this video, I will be discussing DMPA, which is a long-acting reversible contraceptive, and we'll be discussing about the mechanism of action, how it works, what are the advantages and limitations of this method in this video. The full form of DMPA is depot Medroxyprogesterone acetate. So it is a progestin-only injectable contraceptive, which is given deep intramuscularly every 3 months. So here the dose is 150 mg. It is a long-acting reversible method, and it is also available at the government health facilities under the name Antara. And at government center, it is provided free of cost to all the users. Coming to the mechanism of action of DMPA, the primary action is by the inhibition of ovulation. So basically it suppresses the hypothalamic pituitary ovarian axis, and due to this there is a decrease in the gonadotropins that leads to the suppression of FSH and LH. So by suppressing LH and FSH, it inhibits the ovulation. Other mechanisms include the thickening of cervical mucus, which prevents the sperm penetration into the upper reproductive tract. Other mechanism is the thinning of endometrial lining, which is due to the high progesterone and the reduced estrogen, and that makes it unfavorable for the implantation of fertilized ovum. Who can use the DMPA injection? DMPA is suitable for most of the women, either married or unmarried, or women with no children. It can also be given in the breastfeeding women after 6 weeks postpartum, and it can also be used by women where there is a contraindications because of estrogen, for the conditions like migraine, hypertension, or the smokers. So any women who is seeking for a long acting reversible method can use this DMPA injection. This DMPA can be started within the 7 days of menstrual cycle, or it can be used postpartum. If the female is breastfeeding, then it should be given after 6 weeks, and if the female is not breastfeeding, then it can be used immediately. And it can also be used in post-abortion cases. DMPA is started within 7 days of menstrual cycle, then no backup is needed. It is started after the 7 days of cycle, then a backup contraception is advised for the next 7 days. The DMPA is given by the intramuscular route. The sites can be upper arm in the deltoid region, or in the buttocks in gluteal region, or it can be given on the outer side of the thigh. So the preferred and easily accessible acceptable site is usually the deltoid muscle. However, the client preference should be taken into the consideration before the administration of the injection. Some important post-injection instructions include that do not massage the injection site, do not give the hot fomentation on the injection site, and we usually ask client to remain in the facilities for 5 to 10 minutes after receiving the injection. Who can give this injection? As per the Government of India guidelines, the first dose of DMP injection is to be administered under the guidance of a trained MBBS doctor after a proper screening. Then the subsequent injections can be given by either trained ANM or staff nurse. What is the role of ASHA? The ASHA cannot give the Antara injection, but she can counsel the woman regarding Antara, remind the user for the timely administration of subsequent injection, and provide them advice if they have any questions related to the Antara use. DMP injection vial are to be stored preferably at the room temperature and should not be exposed to any extremes of heat and cold, and we do not refrigerate the injection vial. Is very effective, and failure rate is only 0.3%. It means if 1,000 women use this method correctly and consistently for a year, 3 of them will become pregnant. Various advantages, including the contraceptive as well as the non-contraceptive advantages. It is long-acting, highly effective, no daily dose is required. It is private and convenient also. So these are contraceptive advantages. The non-contraceptive advantages include decrease in the menstrual cramps, as it decreases the blood loss, therefore improves anemia, and there is also decreased risk of endometrial cancer, PID, and the ectopic pregnancy. And it is also useful in endometriosis. The most common side effects include menstrual irregularities that can also lead to the amenorrhea. The side effects include weight gain, delay in return of fertility, and the mood changes and the headache. Temporary bone mineral density reduction is also seen, which is reversible. Coming to the limitations, there is no protection against the HIV and RTI STIs. Once it is given, its effect cannot be reversed immediately, and it causes changes in the menstrual cycle and the bleeding. Contraindications include pregnancy, any unexplained vaginal bleeding, breast cancer, any liver disease, and in case of desire for immediate fertility, this should not be used because after the discontinuation of the injection, there is some delay in return of fertility. In follow-up care, we have to provide the MPA card to the patient in which the next due date is mentioned. We also have to maintain the record at the facility. Home visits can be done by ASHA. They can be telephonic follow-up and ensure continuous counseling to improve the compliance. So this is a MPA card under Antara program, and this is a client card which is given to the client. There is details of the injection and other details of the female is being recorded in this card. And this card is to be kept at the facility. Counseling is very important to improve the compliance and to reduce the discontinuation of this injection. So we have to counsel the patient regarding the weight change or mood swings can occur. There is delay in the return of the fertility and the need for the timely injection every 3 months. And we have to make sure that the client is aware about the next due date of this injection. Client is also need to be informed about the menstrual changes which can occur after his use, which can include either the irregular period or the prolonged bleeding or sometimes amenorrhea as well. It is a 3-monthly injection. So injection has to be repeated every 3 months, and it is best to take the next injection on time, although it can be taken 2 weeks before the due date or 4 weeks after the due date of injection. If there is a delay which exceeds 4 weeks, then we have to give injection, but before that rule out pregnancy and advise a backup method of contraception for next 7 days.